In low-grade lymphoma, one of the key updates is the study of the RELEVANCE study, which is a randomized trial comparing rituximab chemotherapy to rituximab and lenalidomide. And this study was a large international trial. It was based on some phase 2 data that suggested the R-squared regimen, the rituximab plus lenalidomide, had very high complete remission rates and very tolerable toxicity. And so that was an exciting early phase 2 study that led to this randomized trial. In this randomized trial, while technically it did not meet its primary endpoint, which was superiority of the R-squared regimen compared to chemotherapy. In fact, the response rates and the progression-free survival between the two arms was nearly identical. And so I think it's interesting because it offers a non-chemotherapy approach to the frontline treatment of follicular lymphoma. And I suspect that some patients and their doctors are going to want to use this approach and avoid the toxicities that we normally think with rituximab containing chemotherapy. The toxicities were different between the two arms. There was a little bit more neutropenia and febrile neutropenia on the R chemotherapy arm, more rashes and so forth on the R-squared arm.